This is a short video on inflammatory eyelid conditions. I'm going to be talking about these four conditions listed at the top here: Blepharitis, Chalazion, Hordeolum, also known as a stye, and Dacryocystitis. And I'll be talking about the pathophysiology and the signs and symptoms of all of them, as well as some pictures. So let's start with Blepharitis. This is essentially just inflammation at the base of the eyelids, at the eyelid margin. You can see in this picture there that it's a pretty diffuse inflammation. So you'll see swelling, erythema, just like in this picture. You can also have scaling of the eyelid margin and crusting. If you look very closely, like this zoomed in picture here, you can see those kind of skin flakes coming off. That's Blepharitis. Overall, probably one of the more benign conditions that you can get. Next is Chalazion. This is a granulomatous inflammation of a blocked Meibomian gland. This is an oil gland in the eye. What differentiates this one is that it's non-painful. You'll have a solitary rubbery nodule deep to the eyelid margin, and it's usually on the upper eyelid, like in this picture here. This is one on the lower eyelid, but remember that these Chalazions are usually non-painful. So these will be probably the only ones on this list that are less painful as the Chalazion. Next is Hordeolum. This is commonly known as a stye. It's an infection of the sebaceous glands at the base of the eyelashes. So you can see that there's like a little painful pustule or nodule. It's red, probably with some pus in it, at the eyelid margin. You can have them internal and external. The glands that they infect are different based on if it's internal or external, but that's not super important. Here's one, or these are both external in these pictures. Here's one that seems to have a couple pustules with pus inside of them. Last is Dacryocystitis. This is an infection of the nasolacrimal duct. It's usually pretty acute. It can be painful. Couldn't find a picture of this one, so here's a diagram. It would be an infection of this part, D, the nasolacrimal duct. And Dacryocystitis means exactly that. So dacro is tear, cyst means like a sac, and itis means inflammation. So you have inflammation of this tear sac. It's always on the medial canthal fold, so that's the side of your nose, so toward the center of your face. And you can have purulent discharge in this as well. Also, notable mentions that are essentially inflammatory eyelid conditions are periorbital or preceptal cellulitis and orbital cellulitis. These are cellulitises that affect the eyelid, but also the area around the eyelid and potentially deeper to the eyelid into the orbital space. I'm not including those on this list. I hope this was helpful.